Plantar fasciitis is a chronic inappropriate inflammation and an inability of the plantar fascia to heal, and it usually happens right where the plantar fascia connects or inserts into the calcaneal bone of the foot or the heel. And so this can definitely be brought on by a increase in activity acutely or by an acute injury. But it's my theory that there's an underlying problem with the fascia that predisposes it to injury. So if you just bought a home with hardwood floors, or you've just started climbing lots of extra steps at work, this can definitely precipitate an episode of plantar fasciitis if the fascia is already weakened by the things that I'm going to talk about at the end of this video. There is a specific point on the medial side of the heel that if the doctor presses it, it replicates the intense pain that you have with plantar fasciitis when you first get out of bed and take those first few steps each morning. And indeed, this was the point I was palpating when my patient hit me. If the diagnosis is in question, then also ultrasound and magnetic resonance imaging can be used to nail this diagnosis down definitively. If this is your first bout with plantar fasciitis, you've never had it before and you've only had it for a few weeks and you go see your doctor, then the current treatment recommendations work for about 80% of people, and that's a series of stretches that you can do, ice massage. One of the best things that patients gave me feedback was I would tell them to take a 20-ounce water bottle, fill it up with water, put it in the freezer, let it freeze, and then do an ice massage by rolling their foot on that frozen ice bottle. That seemed to help people with the symptoms quite a bit. Anti-inflammatories like ibuprofen or Aleve of the prescription anti-inflammatories will definitely give relief of the acute symptoms, but they don't treat the underlying root cause. Steroids in the same vein by mouth will treat the symptoms, but not the underlying root cause. But then also you can have a steroid injection around the plantar fasciitis. It hurts like crazy, but it provides immediate relief. And then the relief can last for a few weeks for most people, and in some people a few months. There's also been some shockwave therapy treatments, the same kind of shock waves that we use to break up kidney stones. In some people provide very good relief. And then a couple of other still sort of experimental treatments would be prolotherapy and platelet-rich plasma. Both of these are injection therapies, one injecting kind of a sugar water around the fascia, the other injecting your own platelet-rich plasma back around this to help stimulate the healing factors and growth factors to see if we can't get this fascia to heal. Now, for those of you having recurrent episodes of plantar fasciitis or chronic plantar fasciitis, let's talk about the root cause, because the root cause I don't think is climbing lots of extra steps or walking around on hardwood floors barefoot. So there are several things that I think are the root cause of recurrent and chronic plantar fasciitis, and they are, in order of importance, glycation. Now, you may have heard of this before. You may have heard of a test called a hemoglobin A1C. When you're chronically eating too many carbohydrates in your diet, which break down into sugar, you're going to have high blood sugar, and this is going to lead to glycation of the hemoglobin in your red blood cell. That's what the test measures. But it's also going to lead to glycation of every other tissue in your body, including tendons, cartilage, muscle, bone, and fascia. And so if you're eating just a diet filled with sugars and grains and liquid dairy and fruit juices, very, very high, and you're in too many carbohydrates, you're going to glycate all the tissues. And if you have a genetic predisposition to have plantar fasciitis, or you just bought a new house and have hardwood floors, but your plantar fascia is already glycated very severely, then you're at much higher risk of developing plantar fasciitis. Another thing is chronic inappropriate inflammation. And so if you have chronic inappropriate inflammation all over your body, one of the places you can have it is in your plantar fascia. And so if you didn't have this inappropriate inflammation, then climbing all those extra stairs at your new job would not cause plantar fasciitis. Another root cause is a decrease in the appropriate growth factors and repair factors that your body should be secreting around your plantar fascia, but because of your current diet, you're just not releasing the growth factors and repair factors that you should be releasing. And then finally, you're not eating the building blocks of collagen, fibrin, connectin, and all the connective tissue that goes into making up this very, very strong fascia. And so your fascia is weak by definition because you're just not eating a diet that's rich in the things that go into making a very strong, vibrant, and vigorous plantar fascia. Now, in the first decade of my medical practice, I had no idea about these root causes. And so I would do all the things I talked about earlier with treatment, but I did not know that there were root causes that I could counsel my patient about. Say, hey, if you change your diet, your plantar fasciitis will just go away over the next few weeks and few months and just will never come back again. So there are some simple steps that you can take, dietarily speaking, that it's just going to encourage your plantar fasciitis to heal and to never give you problems again. So the steps are, number one, stop eating and drinking all of the sugar. Stop that, because that's what's causing the glycation. Okay. Number two is to stop eating grains. Wheat, rice, oats, corn, all the other grains are not normal, natural, ancestral foods. They are modern foods that keep you from starving to death, but they don't lead to optimal nutrition or optimal health. They, in turn, are causing glycation and chronic inappropriate inflammation all over your body, and one of the places being in your plantar fascia. Also, keeping your insulin level chronically elevated because you're eating too many carbohydrates from eating the sugars and eating the grains, you're going to decrease the amount of growth and healing factors that your body naturally secretes. And you're also, if you're eating a high carbohydrate diet, maybe a plant-based diet, maybe avoiding meat and eggs because you think they're unhealthy, then you're just not eating the building blocks for collagen and the other connective tissues that go into making up a very strong, robust plantar fascia. So if you're suffering from recurrent bouts of plantar fasciitis or chronic plantar fasciitis, please do not take anti-inflammatory medications like ibuprofen, Aleve, meloxicam, celecoxib. Don't take these long term. They have many, many other negative effects on your long-term health. Please do not take long-term steroids. Although they help the symptoms, they are causing you more problems than they are helping. And then please do not have surgery on your plantar fasciitis until you've tried at least 90 days of the dietary changes that I talk about in my other YouTube videos on my Keto 101 playlist or my Carnivore 101 playlist. These are the diets that are going to correct the chronic inappropriate glycation, the chronic inappropriate inflammation, and these diets are going to give you the building blocks that you need to rebuild that fascia in a very strong and robust manner so that you just won't have plantar fasciitis anymore.